Hello, everyone, and welcome to the very first episode of the Harmony Healthcare Long Island podcast. We're thrilled to launch this new monthly series where we're bringing meaningful conversations with the people who make healthcare happen across our organization and throughout our communities. Each month, we'll sit down with leaders, providers, team members, community partners, and special guests to discuss important health topics, share stories, and highlight initiative work being done to improve the lives of those we serve. Whether you're a patient, employee, community partner, or simply interested in learning more about healthcare, we're grateful you've joined us. As this is the inaugural episode, it is only fitting that we begin with the leader who helps us guide our vision and inspires our mission every day, our President and Chief Executive Officer. Today we'll discuss the journey of Harmony Healthcare Long Island, our commitment to providing initiative care where it matters most, the evolving healthcare landscape, and vision for the future of our communities we proudly serve. Let's get started. I'd like to welcome today's guest, David Nemiroff. Thank you for joining us. Can you share a little bit about your role and what you do for Harmony Healthcare?
Sure. So my name again, David Nemiroff. I am the president and CEO here at Harmony Healthcare Long Island. I've been working here since 2013, and it is a privilege and an honor to help lead a staff of a little over 400, take care of about 48,000 individuals a year.
Nice. Okay, first we're going to dive into why you chose this kind of work. So what initially drew you to the healthcare field?
So I'm also a trained social worker, and so I've been in the helping field my entire career. Started early in my career working with people with developmental disabilities and mentally ill individuals and people with traumatic brain injury. And then my career morphed where I was running a mental health organization and asked to be on the board here. And I was enamored with the unbridled caring that we could just take care of people, regardless of their ability to pay. And so I wanted to figure out a way to be part of this. Wound up joining the organization in another role early on because, we could just, if you didn't have insurance and you just needed to take care of something, we could do it. We were taking care of our neighbors. And I thought that was amazing. And as a geek who just loves the helping profession, this was an amazing institution. It was young when I started. We've only been around since 2009. And I wanted to make a difference in my community.
Very nice. Is there a patient or staff story that has stuck with you throughout your time working at Harmony?
There's a couple. I mean, some of the staff stories are remarkable where I remember at one point I was an advisor to somebody getting their master's. And now that person's a senior leader here in the organization.
That's cool.
And they've been here for probably just as long as, not longer than I have. There are some folks that our organization's history is interesting, where we were once Nassau County Department of Health, and then the facilities were run by Nassau Healthcare Corporation and then by Harmony. And there are people who've lasted that whole tenure and have seen the growth and the dynamics that we've brought to the community. And some doctors who've been here 20 and 30 years just are enamored with what we do and how we do it. And it's great to have that, gratitude from them that we've invested in the community. And then on the patient side, I don't know what always sticks with me. A couple of different things. COVID was one where, we started asking people just how they were doing.
Yeah.
Like, what do you mean? Like, what do you mean? How am I doing? We're freaked out, but they were like, thank you for asking.
Yeah.
And then we made sure when we were testing folks that we talked to the county and made sure we had food available. Because we figured if people had to isolate, they don't have the ability to get food.
Right.
And so we worked with the county who supported, I think it was Island Harvest or Long Island Cares, a food box that lasts like a week.
Oh, nice.
And so we gave everybody food while we tested them if they were positive, to help with the social determinants of health. And the patient like, why are you giving food? Like, well, in case you can't get out, it's hard. It was really scary in the beginning with COVID.
Yeah.
So, those two instances are things that, it can help with a little bit the why. Why am I doing this? I'm doing this for the community, and seeing our providers and our staff, how they've grown within the organization has been remarkable.
Very nice. We're going to move into the next segment where we want to get to know you a little bit better beyond your title at Harmony. So what is a fun fact about yourself that you think most of your fellow staff wouldn't know about you?
Fun fact. Well, growing up, I was a car guy. So had a hot rod growing up. And I don't think I told many people that. I drive a Toyota, so it's not really a big fancy car now. But I had a 70 Chevelle that I loved as a kid. That was at 17. It was my first car. Had a lot of hot rods growing up. And I don't think I've told a lot of people that.
Is there something in your life you believe has had, or someone in your life that has had a large impact on your leadership style?
A couple of people. A job I had for many, many years with another nonprofit called Free Family Residences and Essential Enterprises. The current CEO, Robert Budd,
Mm.
was a mentor of mine, taught me how to lead,
Mm.
exposed me to trainings from, I remember going to Dale Carnegie to learn how to speak, public speaking.
Yeah.
And really what's most important, which was pretty dramatic, is he had sent me to a training in New York City for the Cornell School for Industrial Labor Relations.
Mm.
And it happened to be on 9/11.
Mm.
And the training was supposed to be in the Twin Towers.
Wow.
And he was the first phone call I got saying, "Where the heck was I?"
Oh.
I said, "About the training you sent me to. Where do you think?" And he goes, "Well, get out." I'm like, "What do you mean get out?" He goes, "Plane just hit the towers." I
Oh
said,
my
"I'm not
gosh.
in Paris. I'm at the Empire State Building."
Wow.
They had moved it. And he's like, "Oh, thank God you're okay." He goes, "Get out
Yeah,
because I'm
that's
worried about you."
crazy.
And but I worked there for 14 years. I still see him to this day.
Very
I must
nice.
know him for probably 30 years, and
Mm.
helped really kind of shape who I am as a servant leader.
Very nice. What's something you're most proud of outside of your work
What is something I'm most proud of
in your
outside of my
personal
work?
life?
I don't know. Pretty quiet guy.
Mm.
I know I've grown over the years to volunteer more to be on boards of other
Mm.
organizations. I like and feel rewarded for the charitable giving I'm able to do. I try to give back to my peer organizations and sister organizations and all the great work they're doing. I'm proud of that, and proud of I'm a a dad with
Yeah.
2 kids and a husband, and some marriage. It'll be after my 30th wedding anniversary coming up. So
Nice. We're going to move into the next segment where we want to know more about the culture at Harmony Healthcare. So, what do you believe makes Harmony different from other healthcare organizations?
I'd like to think, and you'd probably get a better answer from our employees and the folks who work here, is that I know I take very, very seriously the health and well-being of our employees.
Mm.
Um, I try to make sure from just basic benefits and pay that they're not basic. At one point, we had what I called the Rolls Royce of health insurance, where
Mm.
it was a little bit of money out of pocket for an employee, maybe 12%, and the company covered 88%, and that was it.
Mm.
We had a plan where then we gave them like kind of a debit card to cover their copays and stuff. There was no out of pocket.
Wow.
We try to expand benefits where we can, grow pay where we can. We've done some studies showing we're doing a good job. It is hard in our market when we have a Northwell and some other large
Mm.
institutions around.
Right.
But I would also hope that we're kind and compassionate and flexible where we can be.
Yeah.
We listen to our employees, and we invest in them wherever we can. This past year, we did a training with um, I was at Ailman and Associates to help all of our mid-level managers improve in their supervisory skills because that's some feedback we got from employees that was
Yeah.
lacking. Um, we're hosting next month an all-staff meeting, which we hadn't done since
Mm.
COVID,
Yeah.
to kind of help everybody with their why and bring them out of the health centers and the sites for a day, and just to focus on us and reward folks in their wonderful journey that we've had here
Mm.
for 17 years, from holiday parties to just bagel day in the mornings for
Yeah.
folks once a month, to trying to invest in trainings and outcomes for our folks, so they can have a great career, and where we can help them grow from tuition reimbursement to just hearing about their journey and helping them to grow. We just started recently giving out scholarships. We threw a donation that was set up by a board member.
Yeah.
So where students of high schools that we have school-based health centers in,
Mm.
we're giving them a small scholarship, and they'll be an employee of ours.
Oh, very
And we
nice.
hire people from our communities
Yeah.
to work in our health centers, so they're taking care of their neighbors,
Mm.
and we really, really pride ourselves in that. And if you look at our demographics, the percentage of people who are, say, African American or Hispanic that we serve are almost identical to the people we employ.
Mm.
So we try to make sure that we're matching up to the caregiver is also the community member, right?
Yeah.
So and taking care of them. So we really try to make sure that we're meeting the needs of our employees as well as our community.
Very nice. With that being said, we want to move to the final segment. So we want to look ahead to the future of Harmony Healthcare. So what's something that excites you most about the overall future of this nonprofit?
So Harmony has grown significantly since I've started. I think we were around 20 some odd million as an
Mm.
organization. Now we're 60 some odd million, and
Wow.
we take care of almost 48,000 people from maybe 12 or 13,000 people.
Wow.
And our quality is bar none, just amazing.
Mm.
So I'm just looking forward for our continued growth to meet the needs of our community.
Yeah.
So it's really, not growth for growth's sake, but based on the needs of the people that we encounter and what they need. And from adding some additional dental stuff to maybe a new site to partnerships with other organizations that we're talking to now, to getting into using AI effectively that can help us provide better care. We do work with large systems and small community providers, and I love being part of the fabric of our community and how we can grow and kind of fix some of those injustices that have been done by some of our communities who've kind of been redlined and had some racial challenges and had impoverishment economically for years. And I think we're making a difference in providing good quality healthcare in some communities that maybe time had forgotten. We're doing a great job of partnering with our local Department of Health, and we're making strides in getting better health outcomes for communities that at times were left behind, and it's not okay. So I love the fact that we're trying to bring a positive spin and being a good neighbor and growing in a way that really is meaningful for the people we care about. We even have an RV now that goes out to the inn or a homeless shelter and will provide medical care right to their front door, and work with Island Harvest and Long Island Cares to bring food to our diabetic patients to help them eat healthier, and hosting a farmers market in our Roosevelt parking lot in the summers because that's what the community needs, and it's awesome. So I just love to be part of that, and I'm hoping that the next 17 years are just as exciting as the past.
You kind of already touched on this, but are there any upcoming events or opportunities you have planned for Harmony that you're excited for?
Well, definitely there's an all-staff meeting, which we haven't done in many years, so that we're going to do that at the end of July. And we're bringing together some folks, some of our partners from Hofstra to help us with that, and some of our other staff in community engagement. And I think it's going to be awesome. We bringing together people who may not have seen each other for a while, because although we see each other on Teams and Zoom, it's not the same thing from being all together. So we'll have a full day with all the sites being in one location, getting to interact was awesome. So I'm really looking forward to that. And then some of the other stuff. We're going to hear about how well we're doing with quality. Once a year, we hear how we did with our quality outcomes, and we reward our staff with most of the earnings go to them. So I'm really excited about giving them whatever we learn about in August, which is great. Can't wait for the end of the year holiday party. And just all the amazing work we're doing. We're going to be celebrating our 1 year anniversary of the Baldwin High School in September, so that's going to be open 1 year, which is great. Happy birthday to them. And then just there's some grants that are in the works that'll let us do some amazing physical rehab to our sites. If all those come through, 2 or 3 of our sites will get a complete makeover, as they say, that will be significant to improve their flow and their function.
Very cool. So to close out the podcast, is there anything you would like to say to the employees of Harmony who may be listening today?
Well, I just want to thank them. I mean, the reason I'm here is because of them. I have the privilege of working here, but they're amazing. I've seen it in Google reviews. I've seen it in patient experiences. I've seen it in stories. I've seen patient comments. We do Feel Good Friday, and so Shante will put out, "Hey, this is what a patient said." And so the people that they take care of are telling us this is how they're doing. You can't fake those Google reviews. I think last I saw the lowest was a 4.4, and some as high as 4.9. That's why we do it. That's amazing. There's a lot of challenges that the federal government put on us with changes to how people are going to be insured from July 1st on. I am thankful that I'm working with the people here because I think they're able to help us figure out some of these really hard challenges that it's not their fault. It's kind of fested on us by government, and it's going to be a little bit harder to do what we do. But as nobody else, I'd rather be doing this with than the people that are here. The team we have are great. And I am thankful that they're here and that I get to work with them every day.
So to just close out the podcast, we would love if you could finish the sentence. Harmony Healthcare Long Island is special because blank.
If this will work here. Harmony Healthcare Long Island is special because I think it provides a high quality clinical care with a deep-rooted mission to serve and uplift the community. We meet people where they are, especially those who are the most vulnerable.
Amazing. Thank you so much for your time today, and thank you all for listening to today's episode. Stay tuned for all upcoming Executive Leader episodes released once a month, and thank you all again for listening to today's episode.